Are you experiencing any jaw pain, particularly right below your ear or down the jawline in here? Well, it's likely that it's the medial pterygoid muscle, which is one of the muscles that is required in chewing. The medial pterygoid muscle is accessible on the outside here, but then really presents itself on the inside of the jawbone, which is a pretty difficult area to access. However, by working the outside of this muscle, we can have a significant impact on its health. In order to self-massage this muscle, what you want to do is you want to take your index finger and you're going to go right underneath where your ear is. And the action that I'm using and contacting, so if this is the jawbone, I'm contacting the jawbone and I'm just going to try to roll underneath the jawbone. Going to try to roll underneath the jawbone there, okay? So here we are, I'm relaxing my jaw and I'm just rotating my finger, creating just a mild amount of pressure. And that's feeling really great. I'm feeling it radiating a little bit up in and around my ear. And when you find a relevant area, you hold that for as long as it feels good. You can then move a little bit lower to some other areas, other parts of the medial pterygoid muscle, until you get to the angle of the mandible, which is this little junction in here. To go to the lower part of the medial pterygoid, I like to use my thumb, and just with a relaxed neck and jaw, just dig my thumb in there with some gentle pressure, of course. There's a really nice spot. And I'm not using a lot of pressure when I'm working in this area. Essentially, I'm using about 10% of my strength, which isn't a lot. It doesn't take a lot of pressure to have a positive impact on these tissues. And after a certain amount of time has elapsed, I would then move into just a little bit more centered there. There's that nice spot again. And you can go the whole way in along the jawline and repeat on both sides. Remember, respect the injury, be patient with the process, but most of all, be gentle with yourself.